It's Medicare Open Enrollment, and today we are going to talk about how you can use Medicare.gov's online plan finder tool and what you'll need to have with you before you log on to look at comparing plans and maybe even enrolling in a plan. So let's get started. To go over all your options, you can go to the online Medicare Plan Finder. Just go to Medicare.gov and click the button in the blue area that says Find Plans. You'll want to have the list of your prescription drugs, doses, and all of your pharmacy information. If you don't already have an online Medicare account, you might want to sign up for one. We've got another video explaining how to do that too. You can still use the Plan Finder and do some homework without an account, but you can't enroll in a new plan online without using your personal information. If you have an online Medicare account, if you're already enrolled, your drugs will show up in Plan Finder. And if you need to, you can edit them in the list once you log in. You can save your information, so if you need to come back later, it'll be there. If your current plan is available next year, you can also see the changes and how it compares to other plans. If you don't have an account on Medicare.gov, you will be asked to select what type of plan you're looking for. Your options are going to be Medicare Advantage Plan, Part C, or Medicare Drug Plan, Part D. Then you'll be asked if you get help with your Medicare health or drug costs. If you have Medicaid, you have Apple Health and a teal-colored Provider One card. A Medicare Savings Program means the state is paying your Medicare Part B premium. Extra Help means you have lower-cost Part D drug coverage. And if you're not sure about any of these, give 1-800-MEDICARE a call and ask. You'll also have the option to click Do you want to see drug costs when you compare plans, and then you'll have the option to enter in whatever drugs you'll need covered. And then you're going to enter your pharmacy. Check the box for mail order and any local pharmacy you use and any others you might use. That could save you a little money. A new feature this year is that you can narrow your search to include the healthcare providers you need. This means doctors, specialists, and hospitals in your local community. If you skip the feature here, you can add a provider again later in the review. And finally, it'll show you a list of your plan options. You can filter by plan benefits, insurance carrier, drug coverage, or star ratings, or see all your filters at the same time. There's a few filters here we want to highlight for you. First, health plan type. You may find that some providers, including hospitals, may be in the network for some plan types, but not for other plan types. You can click here to learn more about plan types. Next, drug coverage. Most of the Medicare Advantage plans do include prescription drug coverage. It's like your Medicare Part D benefit is part of the package. But please be sure to check. The filter for providers is where you can add or edit the list of providers that are most important to you for next year. You can check the box to be sure that the doctors, specialists, and hospitals you need are included. You can sort by a few options, and you can compare up to 3 plans side by side. Let's talk about the results pages. Your options will be sorted with the lowest annual price first, based on your prescriptions and total out-of-pocket costs for the year. The term deductible can be confusing. Let's unpack that for a minute. This page lists a deductible for health care and another deductible for drugs. That's common. What that means, in this case, is that you'd pay up to $250 for drugs before your insurance paid any of the cost. In this case, the total drug and premium cost for 2026 is $710.85. That includes the $250 deductible for drugs. The Medicare website calculated your estimated cost for the year based on the drugs you entered or reviewed if you have an account. If you're logged in, you can enroll right there with the Enroll button. You can also enroll by calling the health plan or 1-800-MEDICARE. Just make sure you have the plan ID number from the website. That's all we've got for you today. Good luck enrolling. And again, if you have any questions, call 1-800-MEDICARE or visit our website, insurance.wa.gov/Medicare.